Hey guys, it's Brenden Brown of Blue Tiger Wellness. I wanted to do a little quick video to show you the PowerPoint that I put together for foam rolling. This is really something I've been offering for about, I put together in the last year or so, but it is really kind of a holistic way of thinking about foam rolling. It is to get you guys a little less stressed out, and to give you guys a little more fluidity in your flow for your daily routine. And so without further ado, I wanted to just go through the PowerPoint that I put together, and I hope you guys enjoy it. So this is who I am. No, just kidding. It's a culmination of what my experience in professional massage therapy is. I am affiliated with the American Massage Therapy Association, and I also have 15 years of foam rolling experience through personal vendettas with doing self-massage for my own wellness with chiropractors, kinesiologists, personal trainers, and physical therapists, as well as some other friends who are also massage therapists. So what is foam rolling? This kind of course syllabus that I put together is all about the explaining the 5 W's, the what, who, when, where, and why about foam rolling, and then the how is kind of a combination of going through the anatomy PDF documents, which is kind of like a separate lecture document that you get to look at, and also kind of shows you what your anatomy of your muscles are. So a lot of times people know what an area is, like their glutes, for instance, but they don't understand each of those three glute muscles are, where they originate and where they insert, which is also kind of, I'll go into a little bit further about what attachments are and later in this intro video, but this is kind of the structure of the class that I put together. So what is foam rolling? We know what it is. We've seen a lot of the articles going around about personal trainers starting to use it more and more, and also physical therapists, chiropractors. It's really starting to get a lot of recognition in the wellness industry. Is not so much in the medical industry. I think they're starting to realize that it's doing something for the body, but they're not really quite sure what. But they're trying to medicalize it and try to get you to understand what it can do for you. But the best quote that I could find was from someone named Scott Cheatham in the International Journal of Sports Physical Therapy, stated, "It consists of a person simply rolling on a device or a roller to provide direct tissue massage versus the skilled practice of manual myofascial release, which includes direct and indirect techniques." So a lot of times with manual therapy, with massage therapy, we're able to physically use certain techniques that are going to give you this kind of what they call a release, or the fancy term for it is myofascial release, which just means, myo means muscle and fascial means tissue, so muscle tissue release, right? Roller massage is, in their opinion, what they've defined it as is a type of self or assisted massage that uses a device to manipulate the skin, myofascial muscles, or tendons by direct compression. So compression is the main use here, or the technique that's going to actually provide that means to release those muscles. But what I did want to kind of point out here with this course and with foam rolling in general is that you want to make sure that it's not going to go against what you're currently being treated for by a medical professional. If you're under care of a medical doctor, a naturopathic doctor, a chiropractor, physical therapist, or clinician, I consult I direct people to please consult with your primary care physician before taking this course or practicing any type of foam rolling or roller massage in any capacity. So that's just something I want to make sure that we understand as we move forward, if we were to work together. So why foam rolling? So foam rolling, and I put it as FR, I hope you don't mind, is the aiding in removing toxins, which could be like lactate or uric acid or ground substance or lymph in your body that needs to be recirculated as waste or going through your digestion or urinary systems. So what this course will actually try to do is to help you understand all the different body systems that are involved with foam rolling and what actually happens to the body when you foam roll. So it aids in youthful suppleness of skin tone and skin color when those waste or toxins get removed, or that lymph that needs to be recirculated gets recycled through your body. This is a big benefit because it's going to help you looking your best as you age. We all age as humans, right? But it regenerates tissue when you foam roll. But it is also dependent on your body's ability to produce things that help you generate the tissue. So sometimes it's not a direct what I want to say, a direct benefit to foam rolling because it depends on how good your body is in getting rid of those toxins. But we'll talk a little bit more about how there are options available to getting that help down the road. But foam rolling is a good place to start, right? Because it aids you in flexibility and increasing your range of motion of your joints. So your muscles are what are connected to those joints and all these tendons that kind of help muscle attach to the joint proper, but it aids in the flexibility of being able to increase that range of motion, which is really the main benefit of what massage can do for you. So it can have therapeutic effects and benefits for individuals. So people that have fibromyalgic pain or myofascial pain can really benefit if they do foam rolling correctly. Because it firms up the skin when you foam roll and it breaks scar tissue down in the appearance of. So another point with foam rolling is why it's helpful is so there's this thing called muscle spasm cycle. This happens with athletes more than in more active people than it does sedentary or people that just sit at a desk all day and don't work out so much, and this is more for people that are trying to increase tone of muscle a lot and are using movement to try to strengthen their muscles. It's pertinent when you foam roll to keep the body fit and vital enough to keep going back. So I think the idea with this muscle spasm cycle is that you have to do things like foam rolling or compression massage to keep on being able to recover when your muscles are needing that recovery. It increases the resiliency of your muscle tissue and connective tissues, because when your muscles contract, there's a cycle that happens that if it doesn't relax, it'll continue to create pain. So the muscle spasm cycle happens a lot more frequently if you're not able to kind of break that cycle of when the muscle starts to contract because it's not able to get rid of the toxins due to venous drainage issues, or maybe the muscle is cut off from that venous drainage of the lymph that's trying to recirculate back to get purged from your body. So that lactic acid sometimes gets pooled in the muscle. And so what happens is this excess of lactic acid kind of sickens the feedback nerves in the muscle that monitor and report muscle tone to the brain. So sometimes there's these signals that kind of get trying to get to the brain that get kind of cut off from being communicated with your nervous system and your brain to tell it, okay, stop trying to contract the muscle. what happens is the feedback nerve signals to the brain becomes weakened or distorted, and then the brain interprets that muscle as not having enough tone, so it'll try to strengthen it again and again and again until it can get that feedback loop. I would call it kind of a feedback loop. I don't know if that's the correct term. But because the brain thinks that there's not enough tone, it sends it back down to the muscle for a command to produce more tone. But sometimes the muscle tone increases, or reinforcing that cycle over time, the muscle starts to become spastic and hard. So what starts to happen is the muscle can stop doing the work that it's trying to be required to do from the brain signals that are happening. And this happens a lot with athletes, where they start having pain spasm cycles that are unable to get cut off, so they foam roll. Go figure. So enough with the why. I think we can kind of go through every single little point here, but I think it'd be probably overkill for this video. But I do want to move on to when to foam roll, and when not to foam roll. It is perfect. It is the perfect thing when you're in pain or have tension that needs to be compressed to relieve the sensation that you're having that's making you uncomfortable. Maybe before and after a workout. So some people do it before a workout because it helps bring blood to the muscles and to try to get the muscles warmed up enough so that they won't injure themselves for doing a workout. And some people do it after a workout. But sometimes people get better results either or. It just kind of depends. It also is good to break up your day. So when we're sitting at a desk and we're doing something that is repetitive and is kind of, you need a break and you need to get out of that context, foam rolling is the perfect thing to do. All you need to do is just lay down on it, and it's really kind of the way that you lay down on it that's going to make all the difference, and which area you're going to put it on. But after drinking tea, so some people think that there's a way to kind of help your body kind of remove toxins out of their body and to help flush out those toxins by drinking tea, like green tea, for instance, to draw the toxins out of the body. And some people foam roll when they want to feel more range of motions in their shoulders or hips, and that's one of the main reasons why people do it. So what you don't want to do if you're having any so these are the list of contraindications. They say they call it contraindication. That's basically like a reason not to foam roll would be right after an acute injury or surgery that hasn't healed yet, or anything that you're having issues with that a primary care physician is telling you that it would not be good to foam roll. So I definitely want to encourage people to continue following what their primary care physician or doctor that they are under treatment or advisement from are telling you not to foam roll. Then I would follow their orders. If you're susceptible to heart, blood pressure issues, osteoporosis, scoliosis, spinal deformity, extreme medications, or anything that alters sensation, hypertension, osteopenia, if you're pregnant, yeah, that's a big one. You don't want to foam roll when you're pregnant, especially if you're later on in your development or in later stages of pregnancy. Varicose veins are kind of a hard one to deal with foam rolling, because foam rolling has a direct effect on veins in your tissue. If you're sensitive to pressure too much, there are foam rollers that are softer and less dense that you could probably enlist, but there's also ways to just use a rolled up towel. Sometimes they say, oh, that'll hurt if I foam roll. I see those things, and that would really hurt if I sat on it. I just tell people you don't need to use that. You could use maybe like a rolled up towel, for instance, or a really soft ball. Those are just as good. Those are going to help you with that sensitivity of pressure. For a full list, I've provided a list of contraindications on this that you can go to that will help you understand when not to foam roll. But there's so many body systems affected with foam rolling. Your skeletal system, your circulatory system. So I kind of go through and explain in more details. If you want to check this out, we do go through this pretty extensively in my course. But I'm just going to show you kind of the different systems here because we're kind of getting to a big video here. But your immune system is affected. So this is a huge one right now. People are afraid of what's happening to their immune system with this virus pandemic. And I think part of what I think they're afraid of is, like catching it, but this foam rolling system you could do is going to help you recirculate the lymph fluid in your lymph nodes as well in some points. While foam rolling we don't directly foam roll on lymph nodes purposefully, but the tissue is all going to start draining lymph into those lymph nodes. So indirectly, it's going to help recirculate lymph fluid into your lymph nodes, and we'll show you how to do that. But it's best to consult a lymphatic drainage specialist versus foam rolling if that's your primary goal. So there's actually people that specialize in lymph drainage massage. This is not the primary goal of what foam rolling does, but it is an indirect benefit. And your skin's obviously another system that's affected. And so here's some more. So yeah, you can see that pretty much every system is affected with foam rolling, and I kind of show you how to. Excuse me. The anatomy PDF document we go over individually, so this is going to help you get the best results. This technique that I've developed. Oh, there we go. We're at the end. So yeah, there's also view the how-to videos slide. This is going to be kind of an all-encompassing thing that I help you do live, and there is a group on Facebook called Foam Rolling Secrets that is part of this course that you buy. You get to join Foam Rolling Secrets for free, so you get access to the how-to videos. You get access to basically the anatomy document and this lecture, but you will, if you want one-on-one consulting or coaching, foam rolling coaching with me, I would highly recommend that you schedule an appointment with me so that we can go through all these things and kind of holistically put this all together for you. But this is basically one of the most comprehensive things that I've put together, or programs I've put together that pretty much brings together all my years of experience with massage together with being able to do this remotely for people, and I hope this helps. I'm Brenden with Blue Tiger Massage. Thank you so much for sparing the time with me to look at this, and if you want to schedule a foam rolling session with me and to enter this class, please contact me either through email or message. My number is 312-493-6186, and I hope you enjoyed. Look forward to some Facebook Live and YouTube Live videos of actually doing foam rolling, and you can kind of jump on it with me and see how it goes.